it's not clear how CAR Ts are going to fit in. As you know, there's very interesting data published from the Bluebird trial. Nuparaji is the first author on that, NEJM, and there's definitely a signal in very heavily pretreated patients who've been exposed to IMiDs and PIs and daratumumab, and who are very much heavily pretreated and running out of options and showing some great responses. However, they weren't durable. The median progression-free survival was 11.8 months. There are some patients who did benefit, but some who did not, at least long-term. So we need to understand more as to why that is. Is it because these are heavily pretreated patients, beat-up lymphocytes? Should this be moved up front? There'll be a debate tomorrow talking about looking at it at CAR Ts in first relapse versus transplant and other options. So we don't know. The other thing, the BMT-CTN is proposing to do a trial looking at high-risk patients and consolidating them after auto transplant with a CAR T-cell infusion within 6 months of the original transplant. That's very interesting because we already know that these patients don't do well, and this would be an opportunity to study this for a very high-risk patient population and then follow it with lenalidomide maintenance, which is also something we don't know. We don't know how to maintain the response after a CAR T-cell response is generated, and so this is another great question we need to understand. And lastly, we also don't know how to treat patients who don't have great responses, so are less than VGPRs. One is to consolidate with a second transplant or RVD consolidation. And again, in the BMT-CTN, we will study whether or not patients will benefit from a CAR T-cell consolidation to improve their response after transplant. So there's lots of moving parts. There are, if you do a clinicaltrials.gov search in the US and putting in CAR T-cells myeloma in USA, 26 trials come up. You do the same thing, you substitute China, 26 trials come up. So there are lots of different approaches being done with regards to the construct, the cell populations, what to grow up. And so these are all questions that we're going to have a really interesting time studying over the next several years.